Hi, it's Grace Pike. I'm back with 5Features, and today we're back at Ozark Regional Vein Center to talk about the vein screening process. And make sure to like, share, and comment on this video for a chance to win a free facial valued at $100 from a Renew Aesthetics. Thanks for watching.
Hey guys, it's me again, Becky. I'm a nurse practitioner at Ozark Regional Vein Center. And behind me, I have Jamie. She's one of our ultrasound techs that has been here for many years, very experienced in ultrasounding patients' legs to see if they have venous reflux disease. We've got a patient who has graciously agreed to be on camera with us, and she is getting a free vein screening. And so what Jamie is doing for us today is she is using an ultrasound to scan our patient's leg to see if she has venous reflux disease. And you can see she's got the probe on the leg, she's scanning the vein up and down, and she's looking for backwards flow of blood in that leg. This ultrasound will take about 5 to 10 minutes maybe. It's really not a long process. As you can see, there's nothing about it that is painful to the patient. She's just going to stand in that position as we scan the main superficial veins of her legs, again for about 5 to 10 minutes. And if we look on the screen here, we can see where Jamie is looking at the image on the screen. She's trying to find those veins, and she's checking to see if she can find backwards flow of blood in those veins. That's what venous reflux disease is. She's going to put color on the screen so that we can see if the blood is moving backwards and forwards. And we wanted to take this opportunity to talk to you guys a little bit more in depth about the process of getting your legs evaluated to determine whether or not you have venous reflux disease, right? Because you're watching this and you're wondering, hey, I wonder if that applies to me. So first off, I'm going to talk a little bit more about the symptoms of vein disease. So the biggest symptom that we hear from patients across the board is heaviness or fatigue of the legs. You know, I just can't get up and get going like I used to. I get up a few flights of stairs and my legs are just feel like they're gonna give out. So that would probably be the biggest symptom that we hear about. Another one would be cramping or restlessness of the legs. So maybe at night when you're in bed, your legs are so restless and you just gotta keep them moving because that movement just provides you with a little bit of relief. If we look at it from a visible perspective, what are some things that you can see on your own leg that might indicate that you've got vein disease? And I would say a big one would be spider veins, and those are those little teeny tiny, looks like someone's taken a blue pen or a purple pen and drawn lines on your leg. We call those spider veins, and certainly those can be a symptom of reflux disease. Or the bigger, bulgy, superficial varicose veins. And those are the ones that sort of almost look like you've got a rope underneath your skin. Or if we go more along what we see would be swelling. A lot of us have swelling. That can be a symptom of reflux disease. In more advanced stages, you're going to see pigmentation changes, which is darkening of the skin in the area of reflux disease. Most commonly, we see it on the inside of the ankles or the distal, the calves. And then in end stages, we sometimes will even see open ulcerations, which are wounds that don't heal. Or I remember I had a gentleman one time that was walking by a cardboard box, and just a little nick from the cardboard box in a healthy leg would have healed in a matter of days, right? A day or two later, you've got a paper cut on your leg. But in someone who has venous reflux disease, that's not ever going to heal. In fact, it's going to get larger and larger and eventually become a wound that is painful and expensive and requires medical intervention to get healed.
Before my first treatment, I had pain in my legs, heaviness. I noticed swelling more often, and once I came in after my first treatment, I noticed that the pain really went away. It's just a nice clinic, and you can come in and have all this taken care of. There's really no pain involved. Everyone just made the process so easy, and I left after my treatments and went about my normal daily activities, running errands, doing stuff with my kids, so there's really no downtime. for me, I would say there's no reason not to do it because you just feel better after it.
Hey guys, so I have got some really good news for you actually. We have had some patients that say, hey, come to where I am, it's hard for me to drive. So we're gonna do just that. Actually, we set up 2 free vein screening events. One of them is going to be in Fort Smith. We're gonna be there on February 28th. We're gonna be in the courtyard by Marriott. We'll be there from 10 o'clock in the morning till 4 o'clock afternoon. Drinks, snacks, come get educated, come get your free 5 to 10 minute vein screen. We've got the number right here. It's 479-777-3605. Give us a call.
Harrison, we're coming to you for a free vein screening event on March 20th at the Women's Health and Family Center from 10 to 4. Follow us on Facebook for more details.
Like, comment, and share this video. Good news, we're doing a giveaway again this month. At our med spa next door, Renew Aesthetics, we're gonna give away a facial. All you have to do is like, comment, and share, and we put you in the drawing.
So your initial appointment is an evaluation where we start off doing an in-depth ultrasound evaluation of your veins. There we're checking for venous reflux, which is basically the valves in your veins have stopped working, allowing blood to go backwards. Once the ultrasound evaluation is completed, you'll talk to myself or Becky, the other nurse practitioner, and we'll go over a treatment plan for your individual needs.
I had swelling in my legs, pain in my legs, and just after pregnancy, I noticed the symptoms happened increasingly more and more. So I recently had the treatments and I have no pain after those, and not feeling pain in my legs anymore that I was before.
So another thing that I want to talk about is risk factors for vein disease. I would say one of the biggest risk factors, and the reason that 2 out of 3 patients that experience vein disease are females, is because one of the most common risk factors is pregnancy. When you're pregnant, you have a lot of extra blood flow in your body, first off, and that puts a lot of pressure on your veins. And that pressure from pregnancy, particularly if you have had multiple pregnancies in the past, increases your risk for vein disease. People that are standing for long periods at work, that puts stress because that gravity is pushing on your veins and can cause some of that reflux disease. Obesity is a risk factor. Patients that have had a history of blood clots in your legs is a risk factor. There is some correlation between people that are exercising and lifting a lot, the strain that they're putting on their legs actually, and uncommonly, not everybody knows this, but that actually can increase your risk for reflux disease. So we do see a few really in shape individuals that just happen to have reflux that goes along with that. Probably the biggest risk factor is genetics. Your mom and dad had reflux, your brother or sister, your grandma and grandpa have had a history of reflux disease, and that increases your chances.
If you have symptoms of pain, big bulging varicose veins, bleeding episodes, skin pigmentation, swelling, just to name a few, those would be reasons to come to see us.
So the free vein screen, again, 5 to 10 minutes. We don't get a lot of health history. We don't do a lot of education at that visit other than to tell you, yes, you do have vein disease, or no, you do not have vein disease. If you were to come in, have a free vein screen, and we found out that you did have vein disease, we would recommend you come in for an evaluation. After you underwent the ultrasound with Jamie or one of our other ultrasound technicians, you'll meet me, because I will come in, we will look at your ultrasound results together, and we will come up with a treatment plan specific to your leg, your pattern of reflux disease, taking into account, of course, your insurance, and determine what is the best treatment plan for you.
Here at Ozark Regional Vein Center, we have an in-house insurance specialist who helps us to get through all insurance types, including Medicaid, Medicare, and all commercial insurances. We have in-house financing options through Care Credit and Compassionate Finance. Here we treat cosmetic spider veins, bulgy varicose veins, venous ulcers, bleeding sites, and clots.
Obviously, my friends recommended I come here, but I would tell anyone else that's thinking about doing it to come and have the free vein screening, because when I came, I found out I actually had the venous disease. So it was something I had a medical condition I needed to have fixed, and the process just couldn't have been easier. I came for several days for a few treatments, but overall it was very few appointments. I was in and out, and the longest treatment lasted an hour. So it was just an easy thing to do to fit in my normal week, and I've had no downtime from it. So I would say anybody who's thinking about it, just to make yourself feel better, it's a great thing to come check out and see if you need to have it done.
So if you would like to schedule a free vein screening anytime, please give us a call. We've got a number here. It's 479-777-3605. Call that number, tell them you want a free vein screen, and we'll get you set up.
Thanks for watching, and don't forget to like, share, and comment on this post for a chance to win that free facial from Ozark Regional Vein Center's Med Spa Renew Aesthetics, valued at $100. And don't forget to call 479-777-3605 to schedule your free vein screening today. Thanks!